We have two common types of stroke, what we refer to as an ischemic stroke or a hemorrhagic stroke. By far the most common is an ischemic stroke, and that refers to blood clot or narrowing of the artery, which then cuts off blood supply or oxygen to a certain part of the brain. Modifiable risk factors that you can do to try to help reduce the chances of a stroke are visiting your doctor at least on an annual basis. Control your blood pressure, reducing your sodium or salt intake, eating healthier, typically like a Mediterranean diet, which is going to be rich in fruits and vegetables, whole grains, nuts. Stopping smoking can help reduce your risk for a stroke. When somebody's having a stroke, you can refer to the mnemonic B FAST, and it stands for B for balance if somebody's having sudden onset of difficulty standing or walking. E stands for eyes if they have a sudden loss of vision or blurry vision. F stands for face if they have drooping or weakness of one side of the face. A stands for arm if they put their arms out in front of them and it tends to drift over to the side. S stands for speech if they have difficulty speaking all of a sudden or unable to understand their speech. And then T stands for time, because time is of the utmost importance to get person care if you think that they're having a stroke. If you suspect you or a loved one is having a stroke, then call 911 immediately.